All right. Hi, I'm Anthony. I'm the student pharmacist who's going to be helping you out today. What brings you in today?
My name is Chris. I am 41 years old and I have type 2 diabetes.
Okay.
I've had it since I was in my 40s and I've been pretty well managed on insulin. But last month I started really making some positive changes to my lifestyle. I've lost a good amount of weight, my clothes are looser, and I've been walking my dogs most days. And I've noticed that my blood sugars are low in like the early afternoon after lunch.
Okay.
And after I walk my dogs. And I get really dizzy and sweaty and I feel like I'm gonna pass out. And during these episodes, I like just go home and eat whatever I can find.
Okay.
So like I will eat like bread with peanut butter or leftover mac and cheese, candy bars, just like anything to make me feel better. And I also had a heart attack in 2019, but my blood pressure has been good ever since because I started lisinopril after the heart attack, and my pressure's been good ever since, and I occasionally check it at home.
Okay. So first off, it's good to hear that you're making some changes to your lifestyle. When it comes to people with diabetes, diet and exercise is very important, so that's good to hear that you're making those choices. I can definitely help you out with those low blood sugars today, and there are also a couple changes that could probably be made with regards to your myocardial infarction. But is it right if I just ask you a couple questions first?
Yeah, of course.
Okay. So what medications do you take?
So currently I'm taking Humalog Quick Pen. This is 100 units per ml, and I do 5 units.
Okay.
Before every meal.
Okay.
And then I have Atlantis Solar Star, which is 15 units every day.
Okay.
And then I take lisinopril 20 milligrams at night and metformin 1,000 milligrams twice a day.
Okay. And are you pretty good about taking all of these? You don't miss too many doses or anything?
Yeah,
Okay.
I never miss a dose.
Do you take any over-the-counter medications?
Yeah, I take aspirin 81 milligrams every night.
Okay.
But other than that, nothing.
Was that recommended to you by your doctor, or is that just something that you take?
Yeah, I started taking that after my heart attack.
Okay. Are you pretty good about checking your blood sugars?
Yeah, for the past month, I've been testing every time I feel dizzy
Okay.
and sweaty because I know that when I start feeling like that, my sugar is low. So and then I usually check like an hour later after I've had a snack, just to like make sure it's good.
Okay.
And I also test every morning when I wake up.
Okay. So yeah, I can actually see your blood glucose levels here, and you do look to be pretty in range aside from a couple lows, like you said, in the early afternoon and some highs late at night. With regards to these lows, what are your meals like? Like how are you eating? Are you eating 3 solid meals a day or?
Yes, so I can kind of like walk you through my day of like what I eat.
Yeah, perfect.
I pretty much never miss a meal. So for breakfast, I usually have 2 eggs with cheese, avocado, and a piece of toast. I also like to drink that with black coffee. And then lunch, I have a salad with oil and vinegar dressing, and I put cucumbers and chicken on it. And even though I'm like busy at work, I make time for meals. Yeah, I don't skip meals. And then dinner, I usually do like chicken or pork with a vegetable, like cauliflower, broccoli, or asparagus with a side salad. I may have some like pasta or like a potato, but that's rare. And then I snack on almonds, fruits like apples, berries, mangoes, and like carrots and celery throughout the day. And then I have coffee in the morning and seltzer or water throughout the day.
Okay. These lows that you're experiencing, are these before your meals, like your lunchtime? Do you know?
No, they're like after lunch.
Okay. And you're administering your
Insulin before lunch,
Okay.
yeah.
Good to hear. How much time before the meal do you administer your insulin?
Just like what's recommended, a half an hour.
Okay. And then I also see you have some high blood sugars in the late evening. Do you do any like late night snacking around like 7 to 10 p.m.? You may have just told me that in your diet, but I might have missed it.
No, I usually eat dinner between 5:30 and 6.
Okay.
And that's about it. Maybe I'll have like a handful of like almonds.
Okay. What time do you administer your Lantus Solo Star? I have it here that you're taking it at bedtime, but do you know what time you normally take it? Is it around the same time every night?
Yeah, I just take it when the doctor told me to.
Okay. All right, so there are definitely a couple changes that could be made. First things first, you said you had myocardial infarction in 2020. The guidelines recommend that you should be on a high intensity statin for your cholesterol. Your cholesterol is actually all right now. It's not terrible, but in patients who have diabetes and who have a history of cardiovascular disease, definitely need to be on a high intensity statin. So I think we should start you on atorvastatin 80 to hopefully reduce your LDL by at least 50% and maybe even get you under 70 milligrams per deciliter. Do you notice any problems with your blood pressure? I noticed that your blood pressure reading here is a little bit low.
No, I haven't noticed any differences.
Okay. All right, and with regards to your low blood sugars in the middle of the day, it looks like you might be taking your bolus insulin, which is one you take with doses. It looks like the dose might be a little bit too high, especially considering the fact that you're not eating a very carb-heavy meal, especially for lunch. You said you're just eating like salad, dinner, like chicken or pork with a side salad. So like I said, it looks like you don't have a very carb-heavy meal, so we could reduce your bolus insulin, hopefully to try to get rid of some of those lows that you're seeing in the middle of the day. Maybe we can reduce it down from 5 units to 2 units. Have you administer that 15 minutes before meal, or 3 units, sorry. Have you administer that 15 minutes before meals. And then we can just keep checking your blood glucose after meals. I'm also going to consider lowering your lisinopril. Like I said, your blood pressure is pretty low. Mm-hmm. You're on 20 milligrams. You take that at night, is that right?
Yes.
Okay. Yeah, it looks like we could reduce that to maybe 10 milligrams, and then you can keep monitoring your blood pressure at home. How much daily activity would you say you get in a week? You said you walk your dogs, right?
Yeah, so I go on a long walk just about every single day.
Okay.
I walk my dogs every day, but I also like to try to throw in a long walk in there.
Okay.
Yeah, no, my diet's changed a lot. I used to get fast food at lunch and eat a lot of carbs, so it is a big change.
Yeah, it's good to hear that you're making those choices for sure. And can we talk a little bit more about when you're experiencing a blood glucose low, like when your blood sugars are low? You said you're treating it with things like bread with peanut butter, leftover mac and cheese, and candy. Is that right?
Yeah, like whatever I can find in the house.
So there are definitely some changes that we can make there. Those are more complex carbs, so they're not the best for treating your immediate low blood glucose levels. There are some recommendations, such as like glucose tablets. You can take 4 of those every time you're feeling your blood sugars low. Wait 15 minutes and then check your blood sugar again. There's other things you could have like 4 ounces of fruit juice or 8 ounces of milk. You want to avoid these like complex carbohydrates and go to more simple sugars. All right. Is there anything else you think I should know? Are you up to date on your immunizations?
Yes.
Okay.
Yeah, no, that's about it.
Okay. Well, if you do have any, do you have any questions for me right now? Or no?
I don't.
Okay. If you do, you can always just give us a call back here in the pharmacy. Based on the changes that we're making, I recommend we follow up probably soon, like maybe like a week or two from now. We can check your LDL levels. We can see how your blood glucose has been for the past week or two. We can also take a look at your blood pressure too, because like I said, that looks like it's on the lower end. Right, yeah, if you have any questions, you can always reach out.
Okay, perfect. Thank you.
Have a good one.